Hello, my name is Jason Graspaw. I'm an orthopedic surgeon here at St. Joseph's Medical Center. With me is Michelle, our nurse navigator, and today we're going to be preparing you for how to take care of your incision after your total joint replacement. For most of our patients, we use a Pico wound vac. Pico wound vac is a negative pressure dressing. It pulls a suction to the incision. The suction will pull nutrients and oxygen to the incision, promoting quicker healing. It also creates an antibacterial environment, which helps reduce infection. It's going to turn off after 7 days, so expect it to run for 7 days and then it'll turn off. That's fine because most of you will have an appointment with us for a wound check about 48 hours after it turns off.
So we have here the Pico wound vac, and you'll see that there are a set of lights on the Pico wound vac. First, you have the green OK light. That means there's nothing to do. The Pico is working as it's supposed to, and you can just leave it as is. However, there are 3 orange lights on the side here that tell you if there's an issue that needs to be addressed. The first orange light is our high leak light. It's telling you that there's an air leak or it somehow can't get pressure. Usually what it is maybe there is a kink in the cord. So just make sure everything's straight. Maybe one of the connectors is loose and letting in air. So make sure all the connectors are tight. But usually what it is the seal on the bandage has somehow been compromised. So just make sure to go through and secure all 4 borders of the bandage, and that usually makes happy again, and you'll see it go back to the green light. If it doesn't go back to the green light right away, make sure to push the orange pause button and then turn it back on, and that usually will bring it back to the green light. The second light here is your dressing is full light. You will see when you look at your dressing, if there's no more white left and you see that that second orange light is blinking, that means the dressing is full. Now, sometimes you might see some drainage on the dressing, maybe spotting, but there's still some white left. That's okay, especially if you see that the dressing orange light is not blinking. That's very common to have some spotting. But if it is full and there's no white left, this light is blinking, then you can call us during normal business hours and we will bring you in and we will change the dressing. We'll also take a look at your incision. Now, if this were to happen on the weekend, it's okay to wait until Monday morning. Give us a call on Monday morning and we'll bring you in and change your dressing then. The last light is the battery is running out. Your battery's low. It doesn't happen very often, but it takes 2 AA batteries, which you can just take off here, 2 AA batteries, and you should be good to go. However, this pack will turn off automatically in 7 days. When it comes time to showering, all you have to do is push the big orange button and then detach the battery pack from the dressing. You can then simply get into the shower and let the water and soap run over the dressing, but don't scrub the dressing because you don't want to dislodge it. And then when you get out of the shower and you're all dried off, all you have to do is do the reverse. Simply reattach it and push the orange button. It might take a couple of cycles to get the green light back, but just hang in there and the green light will come back on. For knee replacement patients, you might have an ACE wrap over your leg. You're gonna wanna take off that ACE wrap before entering the shower. Then after the shower, you're all dried off and you've applied the Pico wound vac and gained suction, you can then reapply your ACE wrap for compression.